Hello, everyone. Dr. Nick Hilverman here with another edition of Things I Didn't Learn in Med School. Today, I want to use this platform to promote something that's bigger than my platform, bigger than myself, bigger than anything else that I've talked about in the past. Um, this has nothing to do with medical practices or medical school education or the healthcare landscape, but I wanted to use my platform for promotion of bone marrow transplant and bone marrow donation. I have a couple of colleagues who have children who have been stricken with disease processes that are requiring bone marrow transplant as a line of hope for a better childhood and a better life. So I want to encourage everyone out there that is able or even willing to go to the National Match Donor Program website, um, NMDP, formerly known as National Marrow Donor Program, and Be the Match. The website is bethematch.org. I will link to it below on whatever platform you're watching this. And I hope you take the time to order or register with the registry. The registry will send you a kit to test your HLA type, which we know are how our bodies will communicate between itself and autoimmune disorders, or how we will respond as individuals to donations of blood products or bone marrow products or other tissue products. The test is very quick. Apparently, it takes about 15 seconds to swab each cheek. So 15 seconds on each side, and you send it back in. And at least this way you get on the registry. Now, as far as the bone marrow donation process goes, I've actually had this done. I donated some bone marrow when I was in my third year of residency. And as scary and as invasive as it sounds, it really is not that bad. I did mine under all local anesthetic, meaning I was awake for the whole procedure. The doctor anesthetized my skin with lidocaine. Then he went down to the bone and anesthetized the bone with lidocaine as well. I'm not going to go into too much more detail after this just because I don't want to scare anyone off. If you do have personal questions about this, you want to go through my experiences, please send me a message, and I'm happy to talk to you about it one-on-one. The procedure itself only takes 10 minutes, 15 minutes at most. Once you're done, recovery, you might be down for about a day or two with soreness from the procedure, as you would with any. But I'll give you my experience. I actually played flag football the very next day and had no issues at all. I had no pain, post-procedural pain or anything. I was, younger then and can recover a lot quicker. But I just want you to realize that this is the type of response that I had. Um, I'm going to use my colleague Jim Eubanks as the example I'm going to use. And forgive me, Jim, I'm not trying to overstep my boundaries here, but I find your story very motivating and part of the reason why I wanted to make this video. It's something that I feel is very important, and um, watching what you're doing with your child and what you have to go through while still having all the other responsibilities as a physician, um, working as hard as you do and seeing what you and your wife are going through is truly inspiring for me. And I know that you use your platform to encourage others to join the NMDP and be the match, and to get more donors out there for these situations. And I commend you for that. And um, I was just thinking today when I had another colleague um, post something about it today as well. Um, Dr. AJ Jokla, he's based here out of Columbus. He and I have only met one time at a benefit dinner, and apparently his daughter is going through something very similar and is requiring a bone marrow transplant, and looking for donors. And I don't know why it struck such a chord with me again today, and it motivated me enough to hop on to relay this message to other people. And AJ, I hope you forgive me as well for using your story in this platform. I just want everyone else to know I have nothing to gain from any of this. I think it's one of those things that, like I said, I donated my bone marrow in the past, and it's something that I would do 100 times over if I knew that it was going to benefit these young children. And it's something that I'm willing to do over and over again. That short, brief amount of discomfort is absolutely worth it. Um, and I think that's what made me motivated to talk about it today. So yeah, I just want to put that call to action out there. If you've been thinking about it, or even if you haven't been thinking about it, just go to the website bethematch.org, register, and just check your HLA genotypes and phenotypes, and make sure that it is appropriate. And you don't even that doesn't mean you have to donate. I believe you can still deny if you want to donate your bone marrow, but at least getting registered will take you the first step, and it can be very important to save someone's life and have a child live a more fulfilled childhood. Um, yeah. So obviously this is a much shorter video. I didn't want to go too much more into detail about anything else, mainly because this was such a topic that struck a chord with me this morning. I hope you guys will share this. I hope you'll go to Be the Match. I encourage you to follow Jim and AJ. And if you guys have any questions, feel free to drop me a line, drop some comments down below, and I'll talk to you soon. Take care. Bye.